Welcome everyone to join this webinar today. I'm very excited to host some of our great speakers. I'm going to start with Kathleen McGrow. I worked with Kathleen for many years, especially starting from COVID days. Kathleen brought a breadth of knowledge in the real-time scenarios of how providers are engaging with their patients and the challenges that they face every day. So really appreciative of you being in the session today. I also wanted to introduce Dr. Nizar Mahomed. Means our relationship goes a long way now. We work together in for many different projects. But Dr. Nizar is the most unique thing about Dr. Nizar is that not only that he is a practicing physician and surgeon, but he also kind of work with organizations like ourselves to drive or leverage technology to drive efficiency in healthcare organization. So looking forward, thank you very much for joining, so both of you. I want to add one thing which I find the most inspiring, we had an opportunity to talk face-to-face a couple of weeks ago in a conference, and I've never seen, ideas flowing so swiftly between Kathleen and Dr. Nizar, about what challenges healthcare organizations are facing and how especially technology and AI can really enable or truly enable some of those changes now. So looking forward for have a great conversation today. I would love to have Kathleen, you start, from your perspective, and we'll go from there.
Sure. Thanks, Syed. Thanks for having me. And it's great to see Dr. Nizar as always. Very excited to be here. So thank you. So I'd like to talk about some of the directions that the industry is taking and some of the trends that we're seeing now in AI, especially within healthcare. It's really an honor to be here. I love being able to talk about this topic. It's one of my favorites. My background is I am a nurse, trauma critical care, as well as a nurse informaticist. So as we move forward, we can really look at how we're improving health with the challenge of our era today. So it's a challenge. We know that in my 35 years in healthcare, I've really found that I believe we can transcend, if not improve, the challenges that have been plaguing us. And I'm very excited about the innovation that lies ahead. So Microsoft in healthcare really aims to harness the power of data to reimagine healthcare, improve the health of the population, and ultimately to help save lives. Reimagining healthcare really starts with finding a well-defined and a well-scoped problem, and then bringing together the best minds from a diverse set of disciplines and people. That's why I love working with the Quisitive team. That's why I love working with Dr. Nizar. We can really look at how we're trying to solve those problems and how we can look at what the problem is and then the solutions for the problem. And then how does it impact the workflow of the end users that we have? We believe if you can take and analyze a massive amount of data with our cloud computing, if you have an opportunity to extract new knowledge, so it's really data to insights to actions, you can really make a positive difference in how we're taking care of our patients. So we want to be able to empower healthcare teams, improve operational outcomes, coordinate care, as well as personalized care. So our desire at Microsoft is really to do more in healthcare, and it started to change fundamentally when Satya Nadella took over as our CEO about 8 to 9 years ago. He is our biggest champion within Microsoft, and he really wants us to push artificial intelligence in healthcare to its limits. He's actually had a family experience with healthcare, and through meeting with many healthcare leaders, he's pushed Microsoft to bring AI into healthcare. So as we look for the problems that we're trying to solve today, we can see that demand is at its highest with 1.5 billion years lost due to the burden of disease. This statistic highlights the immense impact of disease on global health. The 1.5 billion years lost refers to the total number of years of healthy life lost due to illness, disability, or premature death. This metric, also known as the disability adjusted life years, underscores the significant burden that disease places on individuals and healthcare systems worldwide. We know that clinicians have never been more burnt out, with 55 to 60% of frontline workers reporting burnout before 2020, and now it's even higher. Burnout among healthcare workers has really reached a critical level. We had burnout prior to COVID-19, but it's even increased since COVID-19. Burnout is characterized by emotional exhaustion, depersonalization, and a reduced sense of personal accomplishment. It can lead to a decreased quality of care, increased medical errors, and a higher turnover rate amongst healthcare staff. I work with organizations every day, and I hear constantly of how much burden is on our providers and how they would like to bring joy back to their giving of patient care. We know that waiting lists are at their longest, with 7.6 million in the NHS as of July of 2023, and it's increasing even as we speak. The National Health Service in the United Kingdom is facing unprecedented demand, resulting in record long waiting lists for medical treatment and procedures. Really, as we look at this backlog, we know it can lead to delayed diagnoses and treatment, worsening patient outcomes, and increasing the strain on healthcare providers. And staffing levels are at their lowest, with an estimated global shortage of 30 million by 2030. The healthcare sector is really experienced this huge shortage of workers. It's actually been exacerbated by things we had happen during the pandemic. And this shortage is really driven by aging population, increased demand for healthcare services, and high rates of burnout and turnover among healthcare workers. The shortage exacerbations really are a huge challenge that's faced by healthcare system, making it difficult to meet the growing needs of our patients. So these points collectively paint a picture of a healthcare system under immense pressure, with high demand for services, significant workforce challenges, and long wait times for patients. And addressing the issues really requires a comprehensive strategy to improve healthcare delivery, support healthcare workers, and ensure timely access to care for patients. Some of the AI opportunities that are happening within healthcare is we learn from as we go through and listen to what our providers are telling us. 84% of healthcare executives believe that AI will revolutionize the way they obtain information. This statistic really reflects the high level of confidence among healthcare leaders in the transformation potential of AI. Executives anticipate that AI will significantly enhance their ability to gather, process, and analyze information, leading to more informed decision making and improved operational efficiency. As I said before, data to information to knowledge to wisdom. So looking at data in order to have actions to be able to implement them. By 2030, there will be a projected shortage of 14 million healthcare workers worldwide. This actually has been looming for quite a while, and the shortage is driven by factors such as aging of the population, increased demand for services, and high rates of burnout and turnover. So we're really going to have to address this gap, and this is going to require innovation solutions, including the integration of AI to augment capabilities that allow for existing staff to be able to improve their workforce efficiencies. And I say actually essentially removing non-value work. AI is expected to help prevent medication dosing areas, potentially saving $150 billion by 2026. AI can be crucial to reduce these areas by providing real-time decision support, automating dosing calculations, and ensuring accurate medication administration. By preventing dosing errors, AI has the potential to save the healthcare industry a significant amount of funding. And the pharmaceutical industry is really experiencing rapid growth, with the global market projected to reach 1.8 trillion by 2024, which is actually this year. This growth is driven by factors such as increased demand for medications, advancements in drug development, and the expanse of healthcare access in emerging markets. AI is expected to play a pivotal role in this growth by accelerating drug discovery, optimizing clinical trials, and enhancing supply chain management. However, 81% of patients are unsatisfied with their current healthcare experience, despite all these advances that we have in healthcare technology. A significant majority of our patients remain dissatisfied and essentially are saying their experience is not what they want it to be. Common complaints include those long wait times, lack of personalized care, poor communication with healthcare providers. So we need to address these issues. That's going to require a patient-centered approach. We're going to have to leverage AI to improve patient engagement, streamline workflows, and enhance the overall quality of care. 41% of providers say that data and analytics challenges are preventing them from succeeding in value-based care models. And we know that value-based care models are really focused on delivering high-quality care while controlling cost. So many of our healthcare providers face challenges in effectively utilizing the data and the analytics to be able to support these models. Issues such as siloed data, lack of interoperability, and inadequate analytic capabilities hinder their ability to measure and improve patient outcomes. AI can help improve and overcome these challenges by providing advancing data integration, analytics, and insights to support value-based care initiatives. These points collectively highlight that the transformational potential of AI in healthcare, as well as challenges that need to be addressed to be able to fully realize their benefits. So the pace of change is accelerating exponentially. New demands in uncertain times is driving companies like Microsoft to develop better solutions and technologies. And we like to work with our partners like Quisitive in order to help improve these solutions and technologies. So what is driving us for our new reality? For patients and consumers, it's becoming all about accessing care and addressing where they are anywhere. We must be in the business of changing consumer behavior. Knowledge is currency, and the consumer is the most underutilized member of the care team. Thus, we are enabling proactive, personalized, even remote care. But we will need to be able to capture everything and anything possible about the individual in order to release a relevant and personalized experience back to them. Opportunity to improve trust and communication and visibility to better understand our consumers. And then how do we consume the scale of this innovation to improve frontline worker satisfaction, joy, and productivity? Making sense of all the data required for decision making. We must really leverage next generation technologies to unlock new ways of providing care and doing human at scale, thus to reinvent the business, and thus must exploit and automate all the data running through it and all the elements of computability. Cooperation is essential. Professionals really need to be able to have central observability and connectiveness, which really means making critical data and insights available and secure at their fingertips, and more than answers, those answers within the context of the human. Thus, we are redefining connections and the new age of the ecosystem. We cannot afford to curtail care every time there is a spike. We have to bridge the gap between what we know and what we do. Together, I think we have a responsibility to inspire our talent and put it to work to create a rebalanced and responsive network that gives our populations confidence and hope in these times.
Thank you very much, Kathleen. Really appreciate the insight. Always tell, especially with the AI investments Microsoft has made, Microsoft is providing, technology as a platform where we can really take it, to the next level, right? What you have highlighted about 84% of the executives believe in AI. I think the challenges the healthcare are facing from cost optimization to worker challenges and others. I believe that's what drives a lot of these AI adoption. We're going to see a great traction. We'd love to kind of take Dr. Nizar, your input, your journey into Microsoft technology and how you're seeing the benefits of technology in general, but especially in AI, that what you believe can take it to some of your organizations and the people that you work with.
Thanks, Syed. It's a pleasure to be here with you all. As Syed said, he and I have worked together for a long time, and it's been a pleasure working with and getting to know Kathleen from Microsoft. So I'm Nizar Mahomed. As Syed said, I'm an orthopedic surgeon. We are based in Toronto, Canada, and I still practice clinically in 2 days a week, but I am the CEO of Arthur Health. I've been involved in the journey of value-based healthcare. It's sad to say, but almost 30 years. It's a long time in the making, but I think it's never been more important than it is today. I think the challenges in healthcare are significant, and it's an exciting time. Myself and my two co-founders, who are Dr. Christian Vayet and Dr. Raj Ramprasad, co-founded Arthur Health in 2017. I think one of the unique things is we are all three are orthopedic surgeons who are still practicing, but we bring different skill sets to the table. So my experience has been more on sort of the value-based healthcare journey. Christian, although is a upper extremity surgeon, also has significant deep background in IT and technology, and had 2 startups that he created prior to helping us co-found Arthur Health. And Raj Ramprasad is a spine surgeon who's been involved quite deeply in developing models of care for delivery of healthcare, which I'll speak to a little bit briefly. So we created Arthur Health in 2017 to really address some of the challenges that Kathleen has mentioned to you already. Costs in healthcare are increasing rapidly and significantly, and it doesn't matter where you are in the world. All healthcare systems are facing increasing healthcare costs. We are all facing a human resource shortage, either through attrition, retirement, or just not enough providers. And that's not just physicians. I think the pandemic made it very evidently clear that we need our nursing colleagues and allied health in order to have a sustainable healthcare system that doesn't collapse on itself. The silver tsunami is here. Soon enough, I will be part of that silver tsunami, but folks over the age of 65, the baby boomers are all going to be turning over 65 in the next few years, and that creates its own set of challenges. As we get older, our needs for healthcare increase, and that is going to add another level of stress to the healthcare system. And over the last decade or two, with the transition to more EMR technologies, the administrative burden on all healthcare providers has significantly increased. And this creates another challenge in terms of availability of hours in the day for providers to actually deliver healthcare rather than do non-clinical activity and administrative roles. So these are all challenges we are facing. And I think these all come together to really highlight the need for value-based care more than ever before. Arthur Health is focusing on the delivery of value-based care in the Canadian context through the establishment and management of integrated delivery networks, which I think are critical in terms of delivery. I'll speak to you about two of these. The Ontario Workers Network is a network of 20 hospitals plus independent rehab providers that we established in 2018 in partnership with the Ottawa Hospital. So a little background on workers' compensation. So workers' compensation in Ontario is a provincial or state-run system. There is one insurer, which is the WSIB. It insures 5 million plus lives, over 300,000 employers. And by scale, in terms of North American standards, it's the third largest workers' compensation insurance system in North America. Workers' compensation in Ontario has been structured to deliver programs of care, and prior to 2017-18, the majority of the care was sort of based in Toronto and the Greater Toronto area. And the problem there was that although you could get excellent care, both the workers and physicians had to travel to Toronto for access to care. And for those who may know what Ontario is, it's a very large geographic province, and it really created challenges for WSIB. So in 2017-18, they had put out an RFP to ask the providers in the ecosystem, can we deliver care closer to home in an integrated fashion? And that's what we proposed with the creation of the Ontario Workers Network. The Ontario Workers Network was established in 2018. It is co-managed by Arthur Health and the Ottawa Hospital. Since its inception in 2018, our own has now become the largest provider of specialized care services for WSIB in Ontario, and we provide healthcare services in terms of all musculoskeletal services, traumatic brain injury, concussion services, as well as mental health services and communicable diseases. This journey of 20 independent hospitals and rehab providers could not have been possible without an integrating technology platform. That's one of the pieces of the puzzle that Arthur Health brought to the table. When we started, we had initially started with a bespoke closed network type platform, which allowed us to get going. But really, as time went on, became apparent to us that the lack of integration, interoperability, and flexibility of that platform would not allow us to really enable the growth and the value-based principles that we wanted to achieve in OWN. So about 3 years ago, we had done a deep exploration about what would we want to do for our next or state-of-the-art technology platform, and we had decided we would work with Microsoft's and its capabilities to establish and develop our next platform. Once we had made that decision, we then spoke with Microsoft Canada to ask them for recommendations, and Microsoft Canada suggested we get in touch with MazikCare, who is now part of Quisitive Health. And so I reached out to Syed via LinkedIn, and this is one of those LinkedIn stories that actually led to something great. So Syed responded to my LinkedIn, and that's how we started this journey 3 years ago. Quisitive has been a tremendous partner with us and for us to really help to architect and develop what we call ArthurCare Nexus as our current state technology platform, building on MazikCare, which is a full Microsoft stack from the ground up in a cloud-based scenario. So that journey took about 2 years to architect and develop. And we went live across the Ontario Workers Network in a big bang fashion April 1st of this year, 2024. And it went off without a hitch. And I won't say that lightly because complexity in healthcare is significant, but this was truly a very easy go live scenario. And the entire network now is working on a Quisitive MazikCare platform, which is a full Microsoft stack. The real exciting part about this for us, which has been a dividend unanticipated, was we decided to move to Microsoft 3 years ago, prior to the entire excitement around large language models and natural language processing and ChatGPT. But now that we are on a full Microsoft environment, we will be able to harness all of those technologies and really bring AI to the forefront to really realize the full potential of value-based care. Now that we have all our data sitting in one data pool, applying technologies such as Microsoft Fabric and bringing Copilot to the table, we believe are going to be dramatic improvements for us as we move forward to really deliver value-based care to the next level. And we're very excited about the possibilities of this. And it would not have been possible without our partnership with Quisitive and Microsoft. Yeah, next slide, please. The second story I'll tell you briefly about is the RAC low back program. So this is a challenging issue for us in terms of access, at least in the Canadian context. Prior to this program, people waited almost a year to be seen by a spine surgeon in Ontario for assessment and management of back problems. 90% of these did not require a spine surgeon assessment, but needed appropriate assessment and management. So Raj Ramprasad, one of our co-founders, created this interdisciplinary program to really address the access issue and use healthcare providers at their full scope of practice. So this program was evolved and developed over a 10-year journey through proof principles, pilot studies, et cetera, and went provincial live about 3 years ago. And this is again on a Quisitive Microsoft platform. This provincial program allows citizens in Ontario to have access to integrated spine care, and the wait time has gone down from a year to 2 weeks for assessment. And if there is the need for seeing a spine surgeon, that's gone down to 6 weeks because these patients are appropriately managed. So this has been a significant improvement in value-based care for musculoskeletal patients in Ontario. And again, really leverages the technology platform and capabilities, because integrated delivery networks cannot happen without that integrating platform. And the MazikCare ArthurCare Nexus platform allows us to really integrate independent various providers along with patients to deliver this promise of value-based care. So it's been an exciting partnership, and I think the best is yet to come. Thank you, Syed.
Thanks a lot, Dr. Nizar, and definitely, this is one of those great LinkedIn story. This general this strategy or this relationship have started. I agree with you that the investments we have made to help you become more of a digital first organization are going to pay a lot of dividend, right? And it's not just only with you. Means I've seen the similar kind of scenario with another customers where we have worked with them in last 2 years to help create that digital bridge between their patients, providers, and their payers. And it is coming to the point where things that it took us almost 2 years to create that digital bridge, it is really enabling today some of these organizations to turn AI in like weeks time frame, right? Or months time frame. So it's significantly lower effort. Of course, it's with Microsoft key investment in generative AI is enabling a lot of those workload. I'm going to share another story, and I think we have talked about it, means in the past, where one of our home health organization, which has, means which we have created the digital bridge many, means for two years ago. One of the challenge that they were facing, is in two areas, right? They get a lot of referrals, they get a lot of prescription. The source of prescriptions come from fax to, means to digital to paper and everything in between. Um, we have provided them a standard OCR-based solution in the beginning to scan this prescription, convert into a digital data, so they can follow through the process faster, right? By leveraging generative AI, we were able to, means bring most of those paper-based prescription into a digital platform with almost 80% accuracy, right? And that was a huge, huge value. One of the key thing was that the moment that you scan and automate that process, the next process was that we need to make a phone call with the patient, or we may need to, or patient may call, and we need to provide more, misinformation to process those prescription faster, right? So we automate one workflow and really optimize it, but then we need to kind of, it was required for us to kind of make sure that we're able to process and optimize the next phase, right? So we actually take, they have a 600 people call center, and well, out of 600, we decide that we're going to focus on 200 call center agents and identify how we can bring optimization in those areas, right? So as we have deployed Microsoft, Contact Center Copilot, not only that we have able to reduce the first call or increase the first call resolution much faster, but there are a lot of areas where we are able to move them away from a direct that they need to speak to the care provider or an agent, and they comfortably move into more chat and other avenues to get those answers, right? So we're able to increase their chat conversation. We're able to kind of, close those just through the chat conversation. We were able to increase the way they actually do the reports of, their medication stock and how much more or less medication they need in their delivery schedule. All of the questions like when my delivery is going to come, is my prescription validated, do I need to reconfirm my prescription? A lot of these phone calls were coming. They all becomes more of a virtual phone call by leveraging the contact center agent. So really, if they were getting, 1,500 calls, out of 1,500 calls per day, we were able to reduce that only 83 calls comes to the agent, and everything else is going through the autonomous process. And it's not that just because the volume of call disappeared, it doesn't mean that, let's just slash the 200 agents that we have. What we have seen, and that was the interesting point, that what we have seen is that the patient satisfaction increased significantly because now these agents have more time to understand what really patient use case is or what really patient is asking, and then provide the response with a greater level of empathy. Remember what Kathleen explained in the beginning, that it's almost 81% of the patients are dissatisfied with the system, right? And tools like this is a great example where we can improve patient satisfaction in a significant way. So I just wanted to kind of tell this customer story to kind of set the stage that how Copilot or contact centers are really creating great value. I'm going to walk you through a demo of what we have done, especially with Arthur Health in the OWN scenario. As Dr. Nizar explained, that their whole process start with when there is a referral came in, to provide for example, a post-surgery care for knee surgery or something else, how quickly you identify the care plan, how quickly you identify the care gap, how quickly you understand social determinant of health, and then based on that, create a complete care plan is key to their process, right? It's key to their success. And I'm going to walk you through how it's enabling, means Arthur Health, and go from there. So in this scenario, I'm going to walk you through where Julie Smith is a customer, and we get a referral surgery or referral for their post-knee surgery care. And she had been part of the system before. We have provided similar care before, but we can go through a lot of these detail in the Microsoft Dynamics 365 and MazikCare platform. But what we have additionally added is this Copilot Microsoft Copilot extension, where I can actually ask the Copilot to understand the background of the patient and the referral. Not only that it digitally know what that referral is, but it also tell us the information about when did we work with her last, who was the, means providing the support, did she need a translator, did she need a, means a transportation, and then you can continue to identify each step of the process to make sure that without going through individual record, we know what care plan that she will need. We know, or we can create different care plans. We can create different activities. We can create complete scheduling right by leveraging Copilot. The value here, what you will see is that what Dr. Nizar was saying, that we've gone through this digital bridge exercise or digitalization exercise on the left-hand side, where we have already digitized those records. And you can see within few weeks, we were able to bring this Copilot technology in front of it to not only work with the providers and their data, but we were able to actually work with payer information. So in this case, not only that we want to figure out, if all of the surgery part was covered or if something else was not covered, and it help identify and also create a communication panel, easily and automate the whole scheduling process to get some of those things done, right? So that's kind of create a great, a use case for us. This story about OWN was great because it simplifies the process. When we start working with Dr. Nizar, the challenge that we were addressing, that if we get a complex referral, it takes a day or two to get everything coordinated, to make a patient phone call, communicate with all the providers, get everything coordinated and scheduled, right? By creating the digital bridge based on Microsoft platform and MazikCare, we're able to reduce some of those workload into few hours, right? So instead of you take 2 days, you can get them all coordinated within few hours. Where Copilot has made a significant effort or significant change, that the same thing that you were looking to do in two days, which our platform was able to reduce it to few hours. With Copilot, it's actually reduced to 10, 15 minutes, right? You were able to do similar workload within 10 to 15 minutes because of all the insights and the agents which are working behind the scene within the MazikCare Copilot to drive some of those automation in the process and really reduce the effort and reduce the burden on care provider to manage some of those things. I'm going to walk you through another scenario, which is designed more towards that there's a huge burden on organizations today where patients have now expectation that when I send you a message, I expect to get a response very similar to I get a response on WhatsApp, or I get a response on email, or I get a response on a chat message, right? And that has created a significant burden on care provider, whether you are a care coordinator, scheduling or planning and scheduling of a call, or whether you are a nurse or whether you're a physician. This is a great example that we're able to bring all of that information, whether you have an Epic platform, whether you have a Cerner platform, we were able to bring all of that into a single view of Microsoft Teams and leveraging Copilot and generative AI to actually provide a more cohesive response. In this particular scenario, Abigail Jackson, she's trying to reschedule her call. Number one thing that not only just based on this information, Copilot automatically understand based on the data and integration with different EMR platform that her current schedule or this appointment is dependent on other appointments, right? And it can create a coordination between different providers to figure out what dependencies there are and how do we make sure that we create the next appointment in sync with the rest of the appointment Abigail Jackson has, right? You will see within Teams, all of those messages comes in a single location. By leveraging MazikCare Copilot, you're able to actually enable that response. It is connected with your EMR platform to identify what possible appointment schedules that they can make. It understands the dependency on different care that is required, and been able to provide different options that means these are the appointment slots available, and it create a very empathic means response to make sure that patient really feel means that somebody has paid attention to every aspect of it and ready to provide a good response to them. So if you see, not only that we provide means a generative AI based message, but it's actually built on the data that you have, right? And it create all of those key aspect in their response and simplify the process. So if patient will just click on those schedule item, they will be able to really create the complete schedule within their Epic platform, within their Cerner platform. If you see what's on the left hand side, the messages are coming from Epic, messages are coming from Cerner. And in many cases, some organizations have multiple instances of Epic, right? And it can give all the information there. So this way, not only that Copilot in Basket democratize the information within your EMR platform, but give you a very integrated way to coordinate the care and coordinate these communications more effectively, right? So that's kind of the second scenario, which is in Copilot, it's happening fast. I'm going to walk you through a quick a demo video, which is more about contact center automation, right? So let's run that particular use case. So
What is my copay payment for the annual exam?
Since you are a Blue Cross Blue Shield Silver member, you do not have to pay any copay.
Thanks. I will need transportation for my appointment. Is it covered under my insurance?
Sure. Let me connect you to an agent.
Oh no, it cut off. We have to start that again, Syed. Okay, hold on. I'm just going to do something really quickly before we do that. Don't mention the webinar because I'm going to be using this after that. Okay? All right, so let's do that one more time.
Can you, yes, great.
is my copay payment for the annual exam?
Since you are a Blue Cross Blue Shield Silver member, you do not have to pay any copay.
Thanks. I will need transportation for my appointment. Is it covered under my insurance?
Sure. Let me connect you to an agent.
So you can see in this contact center version that how patients can engage with providers in more of an omni-channel setting, right? Julie Smith started with a simple chat experience, which converted into a digital voice conversation. And when the time was right, it connected to an agent for very specific need. And not only that, it was grateful for the patient themselves, but it was a great value for even agent, because now agent can leverage Copilot to identify and understand what patient needs are and how and where to find this information quickly and how to respond to them effectively. I'm going to walk you through quickly what is behind the scene. We talk about multiple use cases, that how organizations are getting benefit from Copilot or Microsoft AI in general. We have extended MazikCare, Copilot platform, leveraging Quisitive intelligence platform which was built originally to make sure that we can provide a complete AI framework to create net new use cases or agents very quickly, right? On top of it, we have built these two scenarios, but you will see how interconnected it is. Means we have a Copilot for digital front doors. So as you are receiving patient referrals or patient orders, there are agents which are kind of listening, whether you're receiving it through a fax machine, whether you're receiving through a online portal, or whether you're receiving through phone calls or other EMR integrations. We're listening to each of these feeds. And these agents are not just scanning agents so it can provide you the interface. These agents are designed in a way that every integration, every referral, every order comes in, it kind of scan the information, start evaluating if we need, for example, a prior authorization or not, and if we need to send a patient a notification for registration and intake, or do we need to plan and scheduling, do we need to create a chart review or other example from there, right? So if you do need a patient or a prior authorization, it kind of pass that information to another agent which is just designed to do prior authorization, right? It kind of validate the information of the patient referral, what the CPT codes are, what diagnosis codes are, and other comorbidity information to identify if we need prior authorization, and then automatically integrated with different platform, runs those prior authorization for you, continue to go back, scan and check, and when the authorization comes, update the core record and pass on to another agent, right? So for example, the referral or the prior authorization came back, it passed on to care gap closure agent, which kind of review the information, already have an EMR platform, and identify that as part of this order, do we need to consider additional orders or identify any care gap available there. And it's not just on the patient front door element, it's a similar kind of capability where a prior authorization was completed and this order was actually for a procedure in a hospital, it's kind of start creating and pass on to procedure planning order agent, which connect with other agent to make sure that your preference cards are right, and been able to consume most of those processes. So you will see just this example between two copilots. And the core value is that on this Quisitive intelligence platform, there are multiple copilots that we can extend, or multiple use cases that we can extend to drive a lot of efficiency into that whole process. I'm going to go back what Kathleen started with. Healthcare is heavily burdened today. And one of the way to reduce that burden is through is through automation, or what I call autonomous automation, where intelligent agents are actually working on behalf of these providers to reduce the burden, things that they need to do manually. The whole idea is that how do we use some of these agents to automate that process and still keep a human-centered design, so providers are eventually reviewing the information, accepting or making changes as needed. But most of the pre-work was already done by some of these agents. So it's a great way to look at it, and we're seeing a great value to many of our customers. And uh, not just the use cases that I've discussed. We have a AI Innovate program, which was is designed very closely with Microsoft, what we call AI Design Win. And the idea for AI Design Win is that we work with each organizations, kind of start from more of a what are the art of the possible, work through different level of education to start figuring it out. What are the use cases that we can apply for each of these organizations, right? And how do we help create these different use cases or agents which can connect with your existing platform, right? One of the challenge many organizations facing, while this is a great new technology comes in, but I already have legacy system in place. Where AI or some of these use cases are working great, or these agents are working there, where you don't have to replace all of your existing platform. You just have to make sure that these information are exposed, or we can access to the information, and then we can leverage some of these AI agents to grab information and automate the process for you. But the whole idea of AI Innovate is not only that we kind of work through different design labs, make sure that we're able to create the right level of use case backlog, understand what your roadmap and what your maturity curve are, but actually deploy a a completely working use case within your platform to make sure that you can start using some of the use cases that we have talked about and leverage those to automate the process. And from there, we do have the complete capability to deploy the platform, which can help you build many use cases on top of it very quickly. It helps you secure all of the data that you already have in place. And how do we make sure that we are building new capabilities within your organization, both from skill and tools to drive AI innovation to the next level. And then finally, we have a full managed services offering to make sure that as you need coaching, as you need planning, as you need more transformation, Quisitive and Microsoft is there to give you an end-to-end support. And that's really a major differentiator. There are a lot of organizations that we are working with many different use cases. It's like I gave an example of few, but there are literally tens and hundreds of use cases that we're working. And one of the approach that we are following is that it's not just a use case that we picked up, but we actually try to see what value this use case will bring, whether the value that you're getting is going to be a better, increase revenue, improve efficiency, is going to manage risk. There may be a non-financial value, but there's a direct value in patient satisfaction. So you can look for value as one of the key area. But we also kind of evaluate what is the technical feasibility, what is the internal organization readiness is there, what is the external readiness is there, because you can create technology for the sake of technology, or you can create AI for the sake of AI. But if you don't kind of validate each of these use cases on these value and feasibility mark, it's not going to give you the direct value. If you have for example, digital broker is one of the top use case that we are seeing, right? Where not only that it directly impact the revenue because its conversion rate increased significantly, but it also the most technical, feasible. Your customers are ready, so external readiness there. Organizations are ready from change management perspective, so it's create a lot of value there. End of the day, what we have to offer. Everything I talk about AI Innovate program, where the first two columns that we were explaining in the how do we run AI Design Lab and how do we deliver a Quisitive Innovation Center. All of those are 100% free, available to healthcare organizations. And Quisitive is one of the Microsoft partner who have been mandated or who have been chartered to provide those service on Microsoft behalf to be able to identify use cases in each of these areas. So that's really, say a 100% free offering for all the organizations which are qualified to get those offerings from Microsoft. End of the day, what we are really trying to deliver is what we call a AI-driven integrated care delivery platform. And it's not just about hospital and episodic care scenario, but it's designed to focus a lot on preventive care. How do we improve access to care? And based on the data from all sources of information that we are getting, and drive more preventive care or preventive health to ensure that you don't have to show up in hospital, right? But then if you do show up in hospital, how do we make sure that we reduce clinical burden so physicians can focus on your specific need as a patient and drive better care? And then once you're out of the hospital system, how do we make sure that we are following up effectively, we are engaging with patients effectively, we have defined the care plan effectively, we are able to identify care gaps in every setting, and really provide a true post-chronic care services, which can help us improve the final patient outcome, right? So of course, as I said, we want to prevent going to the hospital, but if you are in a hospital, how do we ensure that the outcome is improved in the post-chronic care setting? And we are doing not just leveraging generative AI, but the whole idea is that how do we make sure that we democratize your core data, either it's an EHR, whether it's a psychosocial data, whether it's a claims data, whether it's a finance data, whether it's a patient-generated data. We take all of that information to provide that AI-driven integrated care. And that's what we call Quisitive MazikCare, or a real-time health system vision there. And it's built on Microsoft platform. So it is an AI first, it is a cloud first, it is digital native solution, which allows our healthcare organization to help improve access to care, reduce clinical burden, and improve patient outcome. In the end, thanks a lot, Dr. Nizar and Kathleen, for your great insight and how technology, especially AI, is enabling healthcare organization to drive more efficiency. I want to emphasize a lot that please scan the QR code and start your AI journey, right? Our team are providing, regardless of where you are in AI journey, our teams are providing great value to a lot of providers to help enable either start the journey or help them, move forward on the journey, or really drive end value or use cases more effectively or more quicker. So please reach out to us on ask@quisitive.com or scan the QR code to kickstart your AI journey.